Hi, I'm Dr. Tom Hendrickson, and I want to show you a simple protocol for treatment of the cervical spine using Hendrickson Method. I'm going to take my stance here where my pelvis is facing my patient. I'm my 45 degrees headward, we call this position. Resting one hand on the scapula, one hand I'm going to tuck my fingers under the neck. In this position, what the muscles of the cervical spine pull backward toward the midline. So they're pulling back toward the midline, and we want to broaden them by bringing them away from the midline. So one hand here on the scapula, other hand I can use either thumb or fingertips right next to the spinous process. So I'm going to go on my back foot, I'm going to sink in, and then I'm going to sink forward, taking the tissue away from the spinous process. Now, as I do this, I'm mobilizing the cervical spine. So I'm doing a posterior to anterior mobilization of the cervical spine as I do this. And this is a technique we call cleaning the bone, because the spinous process is right here, and it's not pushing into the bone, but I'm using the bone as a guide to sink into it and take the tissue away from the midline. This is one of the contributions of Lauren Berry, who said soft tissue has misalignment in the body, and in the spine, the muscles pull toward the midline because we're all in this forward head posture, and so when that happens, the muscles pull to the midline. So I'm going to scoop away from the midline in this rhythmic oscillation. If the muscles are particularly tight, I can use a little muscle energy technique. So I'm going to have Jill resist. As I push here, she's going to resist me, and that contracts the extensors, muscles in the back here. And now they're going into a relaxation phase. So if I'm using thumb, I tuck my hand underneath the neck. So when I do the stroke, I'm squeezing my hand a little bit, and that disperses the pressure through my whole hand. So I'm not loading it up on my thumb. Remember, the hands stay very soft, very gentle, even though you might be doing deep work. Everything is relaxing for the patient, so they can completely relax into your work, going into the parasympathetic nervous system. You're performing these rhythmic oscillations, broadening the tissue, and taking it away from the cervical spine. And that's a simple protocol of Hendrickson Method for the cervical spine.